Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. When you receive a diagnosis, it can be pretty shocking at first. You might not even really hear what's being said, and you're certainly going to take some time to know exactly what the diagnosis means and get a better understanding. So, a lot of patients question, well, how can I get a better understanding of the diagnosis? What can I do? And is it actually wise or not to surf the web? That's often the first question that I receive on the very first day right after diagnosis when we meet. So, probably it's not a great idea to get on the web at first, but let me give you some caution and then tell you what you can do. The best way to understand your diagnosis is to really hear what the doctor is saying and write it down. Having someone else with you can help as well in case there are any questions on the immediate information. After that, you can start to do a little bit of research. And this is a really important stage. This information gathering stage could be one of the most important stages you're in when you first get a diagnosis. So let's talk about building a foundation. You want to build a foundation of knowledge about your diagnosis. The best way to do that is to get to the experts, the American Cancer Society, the National Cancer Institute, some colleges, major cancer centers like MD Anderson, Sloan Kettering, even maybe the hospital or cancer center where you live are great places to get information. They all have websites. They also will all send you written pamphlets, handouts, things like that in the mail if you prefer that. It's very easy to find their numbers, and you can even just ask right there at the clinic that you're going to. Ask your doctor's office, they'll have this information. And another good place to go is the Foundation for Your Cancer Type. Nearly every cancer type or cancer diagnosis has its own foundation. For example, there is a Lymphoma and Leukemia Society. There is an American Lung Association. There are lots of organizations like that that have very legitimate and good information. You can start reading the information. Then what do you do to get an even deeper understanding? Ask questions. So at that point, you might be taking these questions into your doctor or the nurse or somebody else who's in the healthcare field, and you get a little bit better understanding. After that, you may go to a support group. But again, I would suggest you make sure the support group is facilitated by or put on by and run by an organization or a doctor's office, maybe even someone who has had cancer themselves, because you really want good, legitimate information. While you're in the support group, other patients are going to offer information. They may or may not be right. So take all of that information with a grain of salt. Make sure you then go back and ask someone who knows well. For example, I find that in support groups, many patients actually leave with more questions than they came. So it actually can produce questions when you hear another patient talking about a medication they're taking or a certain type of treatment that they are getting, or even just a small tidbit about what they're supposed to eat or not during treatment, things like that. Always write these things down, but go back to your doctor, go back to your nurse, and find out if that information is actually true for you. Only because not everybody has a full understanding, and you want to make sure that for your particular cancer, your particular case, you have a deeper understanding. So, in answer to the original question, also, should you surf the web or not? You really want to be so careful on websites. There's a lot of information that's simply wrong, a lot of information that is what I would call lopsided. Like a lot of chat rooms and discussion rooms, you have individuals who are having a difficult time or have had a negative experience or might come onto the website writing with a lot of negative emotion, and they might not be giving you the full picture. They may be giving you only their experience or the very piece of their experience that they're so upset about. So that's what I mean by lopsided. You want to get that information balanced. You might want to talk to more people about it. And again, go back to the experts. Even some people who have had cancer in your family or your friends, but who have checked out their information, you might find that when somebody says, for example, that everyone gets this side effect or all people have this risk, those are very generalized and also exaggerated statements that might not apply to you at all. So you need balance, and you also need things to be less lopsided, but also positive. You want to hear what are the pluses and the minuses. What are the potential good things? What are the potential bad things? So when you're getting a deeper understanding of your diagnosis, I wouldn't just surf the web. You might fill your mind with a lot of negative things and a lot of information that might not even apply to you. But I would get to the experts and get to these specific organizations.